registered dental hygienist. My name is Jane Waits. I'm here with Heather and Calvin Boyd, and we're going to talk about oral health while living with ALS. I've been a volunteer with the ALS Society a little over 9 years, and I am one of a group of dental hygienists that volunteer with the ALS Society. What I have learned from ALS families is that their day-to-day care is very challenging, between bathroom, feeding, medication, dressing. Sometimes brushing and flossing isn't done as often as it should be. What I've also learned is that mobility is a real challenge. Many patients that really valued their oral health and went to the dentist and dental hygienist regularly can no longer get to some dental offices because of the wheelchair problem. Keep in mind that dental hygiene services are affordable. Talk to your family dentist and dental hygienist and find out what arrangements can be made for you. I've also learned from ALS families that the illness progresses at a different rate with every person. So every person living with ALS has different needs and abilities, and they keep changing. One common characteristic is the difficulty swallowing. When you cannot swallow your saliva, it pools in your mouth and grows bacteria. Plaque accumulates more in ALS patients than other clients. The plaque can do damage to the oral cavity if it is not removed on a daily basis. Plaque causes dental caries, gum infection, and bad breath. Gum disease is an infection of the gums and bone that hold the teeth in the jaw, and it is the leading cause of tooth loss in adults today. Another complication of ALS is reduced respiratory function, so they are at higher risk of bacterial pneumonia. So it just makes sense. Reduce the bacteria in their mouth and oral cavity and reduce their chances of bacterial pneumonia. We're lucky today we have Heather. She's going to demonstrate some of the products that I've brought with me today. We're going to go over toothbrushing when you're still able to do it yourself, and then when you're doing it for an ALS patient. One condition that ALS patients do relate to me that happens is the opposite of excess saliva, a very dry mouth. This is caused by a combination of medications and also when they're mouth breathing. Their oral cavity gets very dry. Today I brought some products that are made specifically for that problem. Biotene makes a wonderful antibacterial mouthwash. It's hospital approved. It will add moisture to a dry mouth. This can be applied with a swab, which are available at drugstores, and just swabbed along the gums and teeth for the patient. So Heather's going to do that for Calvin. It's really easy. It tastes good and adds moisture to the mouth. That's great. Another product made by the same company are moisture drops. If you're finding that your patient's mouth is dry throughout the day, often after meals or even before bed, squirt a few drops throughout the mouth, and that adds moisture and makes them much more comfortable. There is a toothpaste as well. For patients who don't have too much trouble swallowing, they can still use toothpaste. Once swallowing becomes difficult, I don't recommend using toothpaste with their cleanings, so keep that in mind. So that's some mouth product for a dry mouth. What can also happen is getting a coating on their tongue. It's important that we clean the tongue on a daily basis to prevent that from happening. So I have a tongue cleaner today I brought with me, and Heather's going to demonstrate on Calvin, our willing model.
We normally use a steak knife. This is much more effective.
I I like it. I like it. This is good.
My cleaver.
When you're still independent and able to use your hands and arms, but muscles are weakening, patients like to have modified grips on their toothbrushes. This is a regular bicycle grip from, I shouldn't say Canadian Tire. This makes gripping a lot easier rather than holding a skinny brush. So it makes people be able to brush their teeth longer, which is great to maintain independence. Another type I have seen is a craft styrofoam ball with the brush pushed through it. It creates a wider grip. It makes it easier. These are really easy to put together, and they also work well for the floss holder. You can adapt it in as well. So that's a good product as well.